We are frequently asked about the value of PSA, especially in 2011, where the economy's in the tank. We're being bombarded with disinformation from politicians and patients and the internet on their play on the importance of PSA. I know that as a third-generation urologist, that when my dad started out in practice, 40 to 50% of the people with prostate cancer presenting to the urologist's office already had metastatic disease. Already presented to the urologist's office with disease that could not be cured. Presented to the urologic office with a disease that would be their cause of death. Since the advent of PSA, since the advent of early detection, since understanding the importance of prevention and early detection, now in 2011, the most common cause of death in patients with prostate cancer is a heart attack. That means that people are going to die of other things other than prostate cancer. Instead of 40 to 50% of people presenting to my office with metastatic disease that cannot be cured, we're talking about something less than 8%, less than 7%. When you ask me, is PSA and early detection important? Is it appropriate? Is it an important aspect of health care? The answer is obvious. It absolutely is.
So the task force has recommended that healthy men do not get a PSA testing, and this is against what the American Urologic Association still believes. Here at Urology Associates, we still believe that PSA is a valid test, as it is the only test that's consistently been shown to be helpful in determining which patients have prostate cancer at an early stage. Given the fact that 1 in 6 men can develop prostate cancer, it is something that, if found early, has a better detection rate, and the cures are a lot better. So as it stands, Urology Associates supports PSA testing. It is still a good idea to speak to your doctor about the efficacy of the PSA test, but we will continue to offer it as a screening tool.
We don't support that view. We believe prostate cancer is a cancer that can be treated, if it's treated early, can be very successful. And PSA screening with the PSA test as well as prostate examination is the only way to find this cancer early. If you don't do any of these tests, you're basically saying that you're going to only find them out at a later stage when they become symptomatic, when they already spread to your bones and everywhere else. So by not doing these screening tests, you're not detecting any early stage cancer.
PSA testing is a very important test. That is not a test for diagnosis of prostate cancer. The test is mainly used to monitor the patient's prostate. So PSA test has helped us a lot to make a diagnosis and treat patients with prostate cancer, but that is not the best test yet. We have to look for a better test than PSA, but that does not mean we should stop doing PSA tests. PSA tests should be used as a tool to make the diagnosis.
Yeah, there's a recent report or statement by the United States Preventive Task Force that was basically suggesting against screening for prostate cancer, saying that it was dangerous, expensive, causing all kinds of complications and problems for men, and at the same time was not improving prostate cancer survival. And there's a lot of issues that I have personally with that statement, being a urologist. For one is A lot of the data and information that they've used comes from urologists, and we've known these controversies all along. There are men that have such a small amount of prostate cancer that they don't need to be treated and they should be observed. And then there are other men that have such a large amount of prostate cancer that when we diagnose them, there isn't much that we're going to do really to help their survival. Doesn't mean that we don't help the quality of their life, though. There can be a lot of issues with local pain and problems or bone metastases and this stuff that can be improved by treatment, even in those that are essentially uncurable. But the real issue is, I think, ultimately, is that probably the comment that they have is a little bit premature, in that it takes a long time for a man to die of prostate cancer, probably 10 to 15 years on average. And prostate cancer screening really didn't hit in this country till about 1990 on a real widespread level. So if you had a man in 1990 who was diagnosed and cured of prostate cancer that otherwise would have died of it, you wouldn't even know that till 2005. Then you have to accrue those patients in a study, write it up, and then publish it. Okay? So it may be that they're looking at this too early to say, gee, there's no survival benefit yet, when if you give more time, it would finally show that. There are other studies out there that have shown survival benefit for prostate cancer, specifically in Scandinavia, where they have a very homogeneous population of men that are in a real favorable risk category for prostate cancer. They've been big advocates to observing it in the long run. There is a study out of Scandinavia, it's probably 5 years old now, that showed that men treated by radical prostatectomy there versus those that were observed had a lower risk of death from prostate cancer. So I think in time more will be known, but my concern is there are men who should be seeking some form of screening. I don't know if it has to be a PSA and an annual rectal exam, every single year, but I think they should have some look at it in their 40s or early 50s and make sure that they don't have a big issue, kind of thing. And I just hope it doesn't cause any increased prostate cancer deaths by not doing that.